All right. Hello and welcome again. We're so grateful that you've joined us today for our webinar on culturally led programs. Again, my name is Allison Neiman, and I'm the Executive Director of Mindful Philanthropy. Mindful Philanthropy was launched in 2020 with the mission of catalyzing impactful funding in mental health, addiction, and well-being. In our work, we connect and convene funders through our gatherings, both in person and online, like today. We guide philanthropic funders towards strategies through our public guidance and custom advisory engagements, and we uplift impactful opportunities for investment. Some of our public guidance to date includes youth mental health, crisis reform, and the intersection of social issue areas with mental health, such as homelessness and women and girls. A few weeks ago, we launched our latest funder guidance called For the Community by the Community, How Philanthropy Can Support Culturally Led Mental Health Programs. And today's session is to help funders learn how to utilize this resource in their grant making and come away with important insights on how to support the mental health of communities of color. But before we get started, I'd like to go over a few housekeeping items so you know how to participate in today's event. At any time during the webinar, you'll have the opportunities to submit your question to today's presenters. To do so, just type your question into the Q&A box at the bottom of the control panel. As time allows at the end of the program, the presenters may address the questions, and they may do so as time allows during the program. We'll be recording this webinar and we'll share the link after the event. Additionally, we'd like to point out that subtitles are available for today's discussion. You can turn them on by clicking the closed caption button below. Please bear in mind that they are automatically generated by Zoom in real time, so we apologize in advance for any inaccuracies they may have. A little over a year ago, it became clear to us at Mindful Philanthropy that funders were interested in funding programs that are doing impactful work in diverse communities, but they had difficulty finding those opportunities at the local level. It was an opportunity for us at Mindful Philanthropy to help find and uplift those organizations that are serving their communities in strategic and impactful ways. Over the last year, we set out to not only find those opportunities, but also help funders be able to identify those that come from within the communities. As we dive into our findings today, I'd like to welcome our Director of Programs and Knowledge, Kristen Ward, who'll be moderating today's discussion. Kristen, welcome.
Thank you, Allison, and thank you everyone for joining us today. As Allison mentioned, I am the Director of Programs and Knowledge, and I helped to co-found the organization in 2020 based on work that was driven out of the Center for High Impact Philanthropy to develop Health in Mind, which was the first of its kind giving framework for mental health. From this work, we've developed deep expertise in other areas and are really excited to lift up this topic around culturally led programs. And culturally led programs is really a reflection of our own evolution of thinking and the learning that we've done over the last 2 to 3 years around opportunities to really lift up the work that is happening at the community level. We've found that every community is different, especially for those diverse communities that have unique needs and histories and traditions that play an important role in their well-being, and especially the role of culture and tradition and connection and purpose in supporting the mental health and well-being of those communities. But across the country, as we look to philanthropy that are looking to lift up those communities and identify opportunities to support culturally led programs that build and reinforce communities' mental health and well-being, we find that there are some distinct challenges in identifying and engaging with those organizations due to the size and the way that philanthropy typically works within communities. Funders often do not know how to identify or assess those opportunities, or unless they're really hyper-focused within that community, they have a hard time really building that trust and vulnerability with the communities. So we created this funder guidance to really help funders create a positive impact for the mental health, specifically focused on communities of color and communities that have been marginalized or left out. And as a result, you'll see key considerations within this guidance for the community by the community. There are 5 key considerations for supporting culturally led programs that my colleague Melissa Ortiz will go over in just a few minutes. And I think what's really, really interesting as we explored this topic and we learned more about those organizations that are working within the community is the importance of those that are driven out of the community, that are born out of the community. Communities themselves know what their needs are. They also oftentimes know the solutions to those needs, and in some cases may just need additional support or reinforcement or assistance to be able to advance and scale those opportunities. So rather than focusing on some of the really great cultural adaptations of existing programs and services and mental health clinical focused programs, we focus this guidance on those that were not adaptations, that are really born out of the community and therefore respond to the community's needs, and supporting those that they're intended to serve with a deep understanding of the community's unique histories, experiences, traditions, and cultures. So in today's time together, we'll highlight why it's important for philanthropy to support culturally led programs right now. We'll talk through how to use this guidance for decision-making. And we'll also review lessons learned from other funders who have deep expertise and experience in supporting other communities of color and other diverse communities across the country. So today we have a really great group of experts and funders who are joining our program. I'm thrilled to be joined by Kathy Gu, Head of Purpose Partnerships and Social Impact at Philanthropy at Pinterest. We're also joined by Vicky Coffey, who is the Director of Programs at the Hogg Foundation. Next, we're joined by Jackie St. Louis, the founder of Tender Tongues Counseling and principal of Define Concepts Consulting, who's also a clinician joining us. And then Enrique Mata, who's the Executive Director of Paso del Norte Center at the Meadows Mental Health Policy Institute, and also a clinician joining us as a nurse. So thank you so much for coming today and hearing more about this work. And now I'll turn it over to Melissa Ortiz, a Programs and Knowledge Associate from Mindful Philanthropy's team, who led much of this work and will walk us through the 5 key considerations and give us a brief overview of our funder guidance. I'll turn over to you, Melissa.
Thank you, Kristen. So I first want to take a moment to go over some definitions and the scope of mental health in our own work. So next slide, please. We use the term culturally responsive programs rather than culturally responsive or culturally informed programs to reflect the need for inherent community leadership to drive these programs. This is based on the evolution of our own thinking and demonstrates the importance of listening and learning from those who are driving these programs on their own. Further, we define community as those based on a shared cultural experience driven by a common racial and/or ethnic identity. So while we acknowledge the distinct sense of community and need for support of other marginalized groups, such as youth more broadly or LGBTQ+ individuals, the focus of this work here is on historically marginalized communities that share a racial or ethnic identity. We also acknowledge that all of these identities can and do intersect, as demonstrated by some of our exemplar organizations. And we also acknowledge that organizations that serve these communities individually and in tandem can also be considered as culturally led. Finally, in this work, we take a broad view of mental health. In our criteria, we include both programs that explicitly address mental health and those that affect mental health in a more indirect way. So for example, we include programs that directly focus on mental health, such as providing culturally led therapy, and programs that address substance abuse or advocate around issues and factors that impact mental health, such as housing or the prison industrial complex. So here, as you can see, we have the 5 considerations that I'll briefly go over before we start the panel portion of the webinar. The 5 considerations are cultural grounding at the center there, community leadership, historical perspective, health promoting practices, and evaluation. If you download the guidance, you'll see that each consideration has a longer definition than what I'll go over today, and multiple guiding questions that we included for you to consider or adapt in engaging with and identifying nonprofit organizations that might be culturally led. As you can see from this graphic, all nonprofits and subsequent 4 considerations should be culturally grounded. That is, again, driven by and for the community. It's important to note that all of our exemplar organizations had to meet this consideration of cultural grounding, as we view it as the foundation of a culturally led program. And I'll also note that after our team met with our top 15 exemplar organizations, we found that meeting all 5 considerations were aspirational for most programs. So very few organizations were able to meet the criteria for all 5 considerations. Next slide, please. So our first consideration is cultural grounding. Cultural grounding requires that the community's culture and understanding of mental health and well-being are inherently and intentionally woven into the program's activities and in the ways in which they engage with their community members who they're trying to serve. So some ways that an organization can exemplify cultural grounding is by reaffirming cultural differences through discussing shared histories or honoring language differences by providing translation services for their programs. The guiding question here will help you identify the specific issue and community that the organization is trying to address and serve. Next slide, please. Our next and our second consideration is community leadership. Community leadership should continuously guide program development and delivery from the get-go. So high-level decision-making processes and ongoing programmatic design should value lived experiences as much as or more as professional experiences, including uplifting the voices of youth and community members most affected by the issue the organization is trying to address. Similarly, staff, leadership, and board members and advisors should reflect the communities served by the organizations. And the guiding question here will help you understand who the organization values and how they're integrating those voices in their programmatic design. Next slide, please. Our third consideration is historical perspective. And by historical perspective, we are looking for programming, organization staff, and leaders that acknowledge the deep roots of structural inequality, poverty, racial discrimination, and intergenerational trauma, and understand how those effects or those factors and consequences affect the individual and community mental health and well-being of the community served. Next slide, please. Our fourth consideration is health promoting practices. Health promoting practices should include a programmatic focus on the well-being and the strengths of the community served, as opposed to fixing the perceived deficits of the community. And it's important to note that these practices can look different across programs and communities, and they will vary. So some examples of health promoting practices is a focus on the integration of art, music, and restorations of identity into conversations around mental health and well-being. Next slide, please. And our fifth and last consideration is evaluation. So evaluation should be integrated into every aspect of the organization by collecting data through methods that authentically value the voices and experiences of the community. Non-extractive evaluation methods could include participatory data collection and paid compensation for members' times. I'll note here that many organizations, especially younger, more grassroots organizations, may not have evaluation or impact data yet. So it is important to understand that what their evaluation plan is for the future, including what kind of data they plan to collect and what their goals are and how they plan to measure that, including what they view as success and how they plan to measure their own success. And I'll now turn it over back to Kristen, who will guide us through our panel portion for today.
Thank you so much, Melissa, and I really appreciate you walking us through. Now, without further ado, I want to open up our conversation with our panelists, as you'll see here, and you'll start to see them popping up on our screen here. Welcome, panelists. So we'll start with you, Enrique. You have many experiences as both a local funder at Paso del Norte Health Foundation in Texas, as well as a clinician, and have developed deep expertise in health policy and systems work through your relationship with the Meadows Mental Health Policy Institute. How does mental health affect the unique communities that you've worked with? And what is the role of considering culture in supporting mental health?
Well, thank you, Kristen. And this is a great opportunity to be here with all of you, and especially with all these experts here on this panel. And so where I live, the Paso Norte region, just to give you all a picture of that, is a region that's got 2 states and 3 countries. We have the state of New Mexico, state of Texas, the state of Chihuahua, and Mexico, and the border of Mexico and the United States. And within that area, if you drew a circle around the Paso Norte region and went out about 200 miles in any direction, you wouldn't find another major city. And so we're challenged by the fact that we're isolated from our state capitals, but we also have this paradoxical strength in that we work together to find ways to manage the conditions that we live in. And I think when we talk about mental health, it's the thread that keeps folks in a lot of ways connected. And when I say that, what I'm talking about is in our community, we have very difficult situations, social determinants, extreme poverty, etc. But there's also this great sense of kindness and hope in our traditions with the Mexican American, Hispanic, and Latino populations, in that we tend to want to help people, and sometimes to the detriment of ourselves. We tend to, and I speak that way, I know friends and family who give more than they have sometimes just because somebody is in a dire situation at the time. And so those conditions also are tremendous strengths when we look at it. You have the traditions of family. Many times individuals are taking care of their family member, their older adult, or children of their family that maybe aren't their own. And on those conditions, they keep those protections. They prevent that isolation that can really be harmful in the long term. So when I think about that, and I think about the role of philanthropy, that sense of heart, that sense of being, there's a way to really look for programming that will help to cultivate that collaboration and help build that connectivity. And some of those examples are things that we have done in our community with building these local consortia to help address mental health conditions. And those are things that I think have shown over time that well-founded, data-informed collaborations can really make a difference in the community, and a philanthropy can really have a tremendous impact by sitting at that table and being a catalyst, a facilitator, nonpartisan, neutral party.
Thank you, Enrique. And I think that's a really, really important point that you just drew home at the end there around setting the table and providing that space and creating the environment for organizations and individuals and community members to do what they're doing best, and really to lift up that through line of mental health and that importance of community and connection, as well as tradition and culture in supporting people's well-being and mental health, while also finding opportunities to support those who are most in need. Jackie, you have a wealth of experience as both a practitioner and a consultant who specializes in advancing mental health support for marginalized groups. You've worked at the intersection of racial equity, behavioral health, social issues, and public policy. From your perspective, how are culturally led programs different from other approaches that philanthropy has taken to engage with communities?
Thank you, Kirsten, and hello to everyone. And I really appreciate the fact that we're leading with the term culture, not race, as well. I think oftentimes, it's perceived that these terms are interchangeable, right? And race typically, does not denote what an individual's culture is, right? So I really appreciate that we're emphasizing, culture. And I think speaking to, how these programs are different from the position of being a practitioner, that, you know, when you ground, you know, responses to individuals' needs in the realities of their experiences, I think it resonates at a deep interpersonal level. But it also part of what you look at when you're, you know, designing, you know, culturally responsible, culturally led programs, is that you are, you know, elevating, you know, the voices and the experiences of individuals from these communities, right? To not only speak to their issues, but to co-design. So there's sort of like this equity that's embedded in there. It's like, it's not a top-down relationship where you're imposing, you know, your views and your decisions and your approach in communities as much as you are inviting them into the process and you're co-designing. I think, you know, these are much more inclusive. And then when you think about, you know, the historical, you know, approach, you know, that philanthropy has had, including community engagement and research, it has been in some ways, hasn't been reciprocal and has been one-sided, where I think value has been extracted from communities to very little benefit, because the disparities that they, you know, experienced, or, you know, the traditionals, they still are, you know, part of their reality to this very day. Right. So, you know, the assumption, there's this sort of like underlying unspoken assumption that, you know, these communities, especially communities of people who have been marginalized, right? You think about people of color, think about the LGBTQI community. The assumption that these communities were dependent and unable to solve their own issues. I think culturally led programming looks at the strengths, right, and the knowledge that exists in community and leans on that and elevates it in a way to help, you know, co-design. And I believe that that has, you know, much more, you know, provide us much more capacity and opportunity to be able to address problems in a real world and meaningful way.
Yeah, I really, really appreciate that. In the mental health space, we hear a lot about strengths-based approaches and being able to support strengths-based approaches. I think that what we have found in culturally led programs and supporting those solutions driven by the community, that we're doing exactly that. We're putting the power and the strength back in, or putting the power back into the community by enabling them to really draw on their own strengths and to continue to move forward with just a little bit of extra support, but support that is directed and co-designed in a relationship that is a little bit more equitable. And it takes a little bit more of the power away from traditional philanthropy and thinking about really lifting up that community and their solutions. Turning to you, Kathy, your role in social impact and philanthropy at Pinterest involves assessing a variety of culturally led programs, as well as those programs really looking at supporting emotional well-being, which Pinterest made the announcement around supporting emotional well-being as the core focus of your social impact programming in 2021. Can you describe why Pinterest really took on this opportunity with Mindful Philanthropy and chose to fund this work to help develop guidance for more funders to consider culturally led programs? And how does this fit into your broader approach to support emotional well-being of communities?
Yeah, thanks for the question, Kristen. Great to be with you all, everyone. So yeah, just to give a little bit of context to start, as Kristen mentioned, Pinterest came to emotional well-being as a focal point for our impact work. And the way that that happened was really in realization of a fundamental connection between emotional well-being and our corporate mission. And our mission is to bring everyone inspiration to create a life that they love. And we recognize that without emotional well-being, it's really hard for someone to be in a place to seek inspiration or to receive inspiration. And so to us, it was a really logical focal point for us to hone in on emotional well-being. And in doing this work, we have a number of values that we're driven by, one of which is a value around equity, which is deeply important across everything that we do as an organization. And the work that we're doing investing in mental health is certainly no exception. And another key value for us is innovation. We're big fans of innovation, and we believe that that's a value that can carry through in this work too, because we believe that if we are to change the status quo in mental health, then we need to be investing in and uplifting different solutions. And at the same time, we know that Pinterest can't do it alone. So knowing that there are these promising, effective programs for marginalized communities, and that those programs face the challenge of being considered not investable by traditional philanthropy, we really saw an opportunity here. So I think in general, we're very mindful of the challenges with a traditional philanthropy approach, which we've already touched on a little bit in this conversation. And we're very interested in how we can break down the barriers for others to join us in supporting these kinds of solutions. And so we saw mindful philanthropy as having this superpower in galvanizing the field. And we felt that this guidance could help to reshape some perceptions while also having a little bit of a de-risking effect for funders. So just viewing this project as holding power to supercharge the movement and rally others. And I know we have been really inspired by some of the culturally led programs that Pinterest is supporting, and we just hope for others to have that similar experience as well.
Great. Thank you, Kathy. I think it's really, really important also to think about different types of innovation and different ways of thinking about innovation. And in a lot of this work, we see the concept of innovation perhaps redefined a bit, and really thinking about what are the innovations that are being driven out of the community, rather than only thinking about innovation in terms of tech or advancing different ways of approaching, but really thinking about what are those innovations that build on the support and strengths in the community. Vicky, you have been with the Hogg Foundation since 2007. And as the director of programs, you've seen firsthand how the Hogg Foundation has supported culturally led programs. You've also seen firsthand how the foundation's approach to this topic has really evolved over time, and that there are lots of key learnings that have incorporated into that evolution. Can you describe how you have approached this work over the last number of years? And what are some of the core learnings that you have captured in that time?
Sure. Again, thanks for having me. And I'm glad to be here this afternoon and morning for some of us for a few more minutes. The Hogg Foundation for Mental Health has been around for over 80 years. And so we have a long history of supporting mental health and wellness in Texas. I have been with the foundation for the past 15 years, and I have definitely seen some evolution over that time. We have increasingly recognized that the value in respecting individuals who are most impacted by our decisions. So my first assignment out of the box came when I was asked to lead our children's mental health work in Houston. And the foundation had worked with a diverse group of community children's mental health providers, local governmental entities, faith and community leaders, and families and youth. And we worked to develop a public health approach to children's mental health in the Houston area. The coordinator of those efforts led focus groups and also looked for input and sought input from the community to prioritize the mental health goals and to recommend areas for funding based on input from the community. That was back in 2007. I believe our biggest shift came when we hired 2 program officers with lived mental health experience to become a part of our Hogg Foundation team as consumer and family liaisons. They were basically brought on and asked to be transparent and share their experiences of what it was like utilizing mental health resources and services, and also then to help us learn as a foundation what changes they felt needed to be made in order to support individuals living with mental health conditions. And so their voice and their input shaped, changed, and guided the strategic direction that the foundation took to live out our mission and vision and values of Miss Ima and her brother, Will Hogg. That was the initial step, I think, that the foundation took to shift our focus from an illness model that supported mental health treatment and services and using that traditional medical clinical model. We shifted that to a recovery model. And that model of recovery is built on the belief that people with mental health conditions should have a voice in their care, and that recovering from a mental health condition could be achieved when you just listen to people, ask them what they need, ask what they want, ask them what they feel is important to being well, and then create those resources and create the access to those resources. So that led our work and understanding that we may have expertise, but it helped us recognize that we're not the experts, and that culturally led programs and supports have to be driven by the individuals and the communities that are most impacted by our work. So if we fast forward to 5 years ago, about 5 years ago, when we shifted our work upstream, basically we shifted our vision and moved more towards the recognition that people thrive in communities that promote mental health in everyday life and don't focus as much on the illness, but look at how do we help people get well and have access to things that help them stay well. We also recognize that mental health is not solely an individual responsibility, but we're all products of community conditions. And so we have to create environments where people can be well. We then shifted our funding to match that vision and supported community-based efforts and culturally led programs that are really centered around the voices of, again, people that are most impacted by our funding. With that, we learned a lot. I could go on forever, but I won't. We learned, first of all, that we had to step back and listen. We had to listen to what individuals are saying that they need to improve their well-being and their communities. They know. We also recognized again that we're not the experts, and that the experts and the expertise lies within the communities. And so we had to learn to trust community. We had to be willing to learn from them. And we also recognize that, again, they come with the history of knowing what has worked, what hasn't worked. They have those relationships with their community members and partners. They know where the gaps are, and they also know where the opportunities are. So just again, stepping back and learning and recognizing what their strengths are and building on those strengths. Just a few of the things we've learned.
No, that's wonderful, Vicky. And I really appreciate your emphasis here around community voice and the power and the knowledge and expertise that comes from the community. Kathy, as we think about how Pinterest has considered community voice and culture when identifying programs and making funding decisions, how have you incorporated community voice into this process, especially when you're considering those programs that aren't, mental health programs per se? They might be looking a little bit more upstream or in the protective elements of mental health and well-being.
Yeah. So our approach is always to center the communities rather than to center ourselves. And that means allowing the communities to lead us. Kristen, you talked about trust in the beginning in your opening remarks. And I think trust is really important. And for us, we look to connect with who are the existing trusted centers, organizations, leaders, and allowing them to lead us, to direct us. And I think a component of that too is really understanding what the community's definitions of wellness and mental health are. And they may not use those words. Often they don't. And then also looking at how they prioritize what makes them well from their perspective, right? So again, like decentering ourselves, centering the communities, and taking the lens of their perspective. And this definitely directly connects to one of the considerations in the guidance around looking for health promoting practices. I think some of the partners that we are most excited about actually don't use the mental health language or describe themselves as mental health organizations. But what they do have is a strong understanding of what wellness means to their community and how to promote it. So I think for us, it just means having our antenna up a bit more we have to do a little bit more work on our side, and also leaning on our existing understanding of health promoting practices to be more proactive in the relationship.
Yeah, I think that's really, really important, especially your point around centering the community, and being able to really follow their lead. And whether it be around the language they use or the practices and traditions that really foster mental health and well-being, even if they're not using those terms, and really listening and understanding what it is that's driving the outcomes that they as individual organizations and community members seek. Enrique, as you work directly with your communities, both as a funder and a clinician, and looking more at the systems level, bridging that gap between kind of bottom-up approaches and top-down, how can funders, both local funders and funders who are maybe looking at a broader level, how can they foster community and connection as a protective factor for loneliness that you mentioned, really around isolation, in communities around culture and tradition?
Yeah, I do think, you know, when I think about, and I'll use the example of our community here in the Paso Norte region, you know, the Paso Norte Health Foundation was formed back in 1995, and its mission to promote health and prevent disease looked at a wide range of health impacts and health opportunities, but it was really meeting people where they are and trying to identify the programs nationally, internationally, worldwide that might match to help people engage around the topics of health in all different aspects, whether it's nutrition, physical activity, mental health, sexual health, those kind of things. And but the most important thing that came up was that every one of these, while we developed these portfolios over the years, the common threads that you saw in there that help keep people connected was that you created these forums of individuals in the community, helping them to understand that they're not alone, that they're able to connect with each other and start to say, hey, you're my neighbor. I didn't realize that you are dealing with the same conditions I am. Eggs are costing as much as for you as they are for me, you know, and so those kind of connections help you to maintain that important piece of emotional well-being that keeps people moving forward, that kindness, that caring that you can share with each other. So when I think about grantees, I think about organizations where funders identify these portfolios, help develop these opportunities for nonprofits to build their capacity and offer these programs to the community, make those forums available. That's a very, very important component and role that a philanthropy can play. But then if we talk about from the top down, you know, this is really the grassroots part of it. And when we talk about the top down, really looking at ways to build collaborations. One of the examples that I could use for that is what's recently happened with the Paso Norte Center. As a program officer with the Health Foundation for 20 some years, you know, working in these different arenas, we developed a wide range of initiatives. But in the arena of mental health, it never became more important than no other initiative became more important than this one for me, because we saw the need. We saw that people in the community just could not get along on this topic. Whenever they came together, they were laying blame at each other. It's your fault that these kind of tragedies are happening for us. And so around 2011, when we were working through this, working with folks that would eventually become the Meadows Mental Health Policy Institute, we identified a way to look at what's the best possible situation for our mental health system of care. And let's compare our community to that. You know, it looks aspirational, like, oh my God, you know, that would be impossible to reach. But where are we? How far are we away from that? And because we were able to bring those data to the table, because the foundation acted as a neutral facilitator, it created a strong movement in the community. We had this El Paso Behavioral Health Consortium develop. As the consortium developed, we realized that we do need that thought leadership. And so the alliance between the Meadows Mental Health Policy Institute and the Health Foundation formed this Paso Norte Center. And what we're seeing now is our feeling is that we have been able to take the voice of the community, put it to the state level and the national level for policy change that can help free people to make good choices, give them the knowledge and skills they need. And that's just a tremendous catalyst, again, that a philanthropy can play. I think when we look at how that's working for our community, It's great to be able to draw on that thought leadership across the different folks that the Policy Institute brings to the table, and then look at the people in the community, the key leaders and the challenges they're facing, and then kind of put those two together. Preventing loneliness at all levels, building connection at all levels.
Yeah, I really appreciate that, especially around bridging that gap. And where there is knowledge that is held outside of the community that can help to inform practices or structures or collaborations, while also really lifting up the data and information and learnings that are within the community that can inform how the system is structured, and helping to create those channels of communication and ensure that there is listening and learning across sometimes what we see as our silos within our state and our regional systems. On that same line, Vicky, I'm curious to turn to you as you think about how funders can evaluate community-led programs, and how community-driven approaches to evaluation may look different from the traditional funder-driven or philanthropic-focused approaches to evaluation. Vicky, can you share some insight on how philanthropy can effectively partner with communities in the evaluation process? And in that same vein, maybe also reflect on some of the terms that communities may use in defining wellness and mental health that might inform how we evaluate the impact of these programs.
Sure. First, I think we just have to ask ourselves the question as funders, who is the evaluation for? And what is the intent of that evaluation? I think it's very important for our community partners to understand the purpose of the evaluation. Why is it important? What is it? What is evaluation? What is it not? And unfortunately, there have been times, I believe, where communities have experienced having outsiders come into their communities, offer programs and services, and collect information and data, and that's it. And the data that's collected has not been shared, and the community doesn't hear anything about what was collected. And to me, my understanding is that creates feelings of mistrust, and it also can create feelings of exploitation. And so again, we have to share the intent of the evaluation and the message that the evaluation is intended to be helpful. It's not there to rate them on what they're doing right or what they're doing wrong. And one big one is that their funding is not dependent on the evaluation. I think that's often a mistake that people, an error that community members feel, is that if we don't do it just right, the funding is going to get pulled. That's a fear. And so making sure they understand the evaluation is not there for monitoring purposes. And community members also need to understand the importance of their role as active agents, as co-creators in the evaluation, and they're active agents in their change within their own communities. So the goal is to create an environment that promotes learning together. And the purpose of that learning is to improve the process. And that should be based on feedback and input that we get from the community. And that input is going to help create changes that create better outcomes, again, leading to wellness of community members. We've used at our foundation, I'm sure others on the call have used community-based participatory research model, as mentioned in the report, in your report that you've shared with us recently. It's important also learning from that report. It shares that the evaluation team truly needs to see the value in putting community first and as true partners. We've even shifted our language at the foundation. We used to call our grant partners grantees. That sounded like they were recipients of something that we were giving them. They weren't a partner with us. So we shifted our language, and now we refer to our people who receive funding as grant partners, because we have to, in our minds as a funder, recognize that we're learning alongside them. So it's important that we've been real intentional in selecting evaluation teams that also see the value in putting community first and recognize that the community members are true partners in the data that's being collected. We have co-created the evaluation with community members taking the lead. They tell us what it is they want to know. What do they want to know about their communities? When we leave, what is going to help them have a better understanding for what works and what doesn't work in their community? So really, the evaluation team's role is to facilitate and support the refinement of the metrics. or success indicators with the community, but not to come there to evaluate them. And so they also, with the evaluation team, we want them to support building the capacity and teaching and coaching and mentoring so that we teach communities how to fish rather than take from them. They, again, get data that's helpful for a future funding request, for learning how to improve their communities and just live better lives. Lastly, we have to communicate that community-driven change includes both some wins. We got to talk about the things that are working and celebrate when they work. But we also have to talk about those things that slow us down, those speed bumps, those potholes on our journey. And we have to learn from those things too. It's okay to make mistakes. And we learn from those things. So we both grow. Again, it's mutual. It's a mutual relationship where both as funders we're learning, but more importantly, that our community members and partners feel like they are learning from something from this journey as well.
Yeah, I think that's really, really important. And something that we don't see enough of in the philanthropic sector is around sharing when things don't work and communicating with a sense of vulnerability and learning posture, because we don't want organizations to continue to make the same mistakes, but to do it in a safe space where, to your point, organizations won't be evaluated or rated based on any failure, but they will be supported in their way forward and their improvements, but really kind of repositioning philanthropy to share those learnings and to share those failures or learning opportunities. So Jackie, now turning to you, I'm curious, as you think about kind of the full spectrum of supports for mental health, all the way from health promotion to treatment, including both kind of the clinical approaches to treatment as well as the wraparound supports that individuals need to be well. I'm curious how you think about the culturally led programs that we've been talking today and how they fit within that full continuum. And if there's an opportunity to lift up those programs for greater scale and replication beyond the communities that they're currently serving.
Sure, wonderful. So I'll try to answer that question. And I see there are also some questions in the chat, and I really want to ensure that there's value for folks who are here and looking at the time. So let's see if my student loan dollars actually for a purpose, if I can hold all of those things at the same time. So bring your programs to scale. And then this also want to highlight the questions as to how communities have defined wellness. And then there was a question that is specifically focused on how you sort of like, hold or balance, two realities and two truths too as well. So one, scaling programs. I think first and foremost, we've heard it, sort of like, repeatedly here that, success should be, defined by communities. That is a reality that should drive the way in which we should do our work, right? So when we think about, wellness, what wellness looks like and how it's defined, I think for, the sort of like traditional definition of wellness is, community, well-being, right? Sort of like, the combination of socioeconomic conditions and political conditions, of course, in communities where individuals are able to thrive and achieve, their full potential. I think for me, when I consider wellness, once again, we talk about culture. Across cultural groups, that looks different. And I think for the most part, cultures of individuals that have been marginalized, wellness for them is the ability to have autonomy over their lives, right? So I think about indigenous populations who are unable to, engage in their sort of like, traditional practices, sort of like, an EP or sweat or longhouse, right? They're reclaiming that part of their identity, right, for their own wellness and health. And that's being incorporated into programs. So what does mental health wellness look like for some populations? It doesn't look like the traditional thing. And I want to tie that to, right, I like using these metaphors that helps us to understand, these things in some, really simple ways, right? So when we think about, what that looks like for the work we do, it looks like genuine relationship and it looks like listening. So if we apply it within the context of a relationship, one and their partner are having a conversation about needs, right? We want to listen non-judgmentally and we want to listen to understand, because individuals are experts on their own lives, they're experts on their own needs and experts on their own desires. So if I were to be in a relationship, let's say I'm married and my partner says, hey, we need to have a conversation about my needs, and I am being dismissive about that, I wouldn't be a good partner, right? it would be there's some inherent, assumed, internalized sense of superiority that I would have to not want to listen to someone speak about the realities of their own lives. And I think similarly, this is what we can bring into terms sort of like racism or an internalized sense of superiority. When we go into communities and assume we know what they need, right? And not listen to them. So then this is where equity comes into play. If communities are saying we want to have a sense of belonging, I think sometimes what's not understood is because they have been disallowed from participating in the enterprise that's capitalism is, there is sort of like this financial or economic undertone that goes along with that. And I think hence this is the role for philanthropy. Like, how can we show up, right? And tie this sort of like, community and cultural desires to the reality of the world that they currently live and exist in, right? And support them in that regard. And so when I think about that, right, and holding those two truths and that reality of the experience of communities trying to heal themselves and trying to do better, and systems that were created inherently to oppress, I often say, like, broken systems are created by broken people. So I try not to hold on to the truth of systems being oppressive as much as people need healing. People from all cultures, including white wealthy people, do as well. Okay. So I hope I was able to touch on some of these things, but this is sort of like, my sense is that we need to be in genuine relationship with community. We need to listen to understand, and we also need to be culturally humble. And that cultural humility should go both ways.
Yeah, I think those are really, really important points. And I think that you reinforced here some of the community conditions and the realities of the systems in which we're operating. So we don't operate in a vacuum and just that we want to support communities and therefore we do. We have to understand the structures and the historical factors that have informed how communities are and how they live and the conditions in which we experience. But we also see that different systems are incentivizing support in different manners. So we have a question here around how culturally led programs really sits within the medical model and the approach to mental health that is really focused on illness and supporting groups based on the experience of a diagnosis and illness, and how to hold the tension between that system and the incentives for that system to continue to operate in the way that it is, while also engaging communities to perhaps reimagine or shift that system. Maybe Enrique, you could take a stab at that one, and then others if you want to provide any additional context.
Thank you, and I'd love to, I'm dying to say something about that, because it is, I mean, when we talk about the medical model and the frustration about allopathic medicine and cheap complaints and that the timing that you've got to see so many patients so you can make a profit, et cetera, but it takes away from the idea of health, and health is really looking deeper into, things like the emotional well-being. You want to do some chronic disease self-management. You want to make sure that people are emotionally ready to understand and comprehend how to take that information and be health literate and say, okay, I'll do this. But when it's overwhelming, it's not helpful. But unfortunately, our systems, the way we have reimbursement models and those kind of things are so complex now that it's very difficult to think, can we ever change this? At the national and state level, the Institute is exploring areas for mental health parity, how we can open those doors and say, let's bring back those reimbursement models that embrace the whole system, inclusive of mental health and emotional well-being. And then at the local level, looking carefully at how to reintegrate mental health and substance use conditions back into the primary care setting to reduce the stigma that when you walk through the front door, not everybody needs to go to specialty care, like not everybody needs to go to a surgeon immediately, right? You need to find a way to look carefully at what the condition is alongside your doctor with some trust. And so building that relationship is really important, and it's challenging. And I think tools that are developing now, we've got technologies, telehealth and those kind of things that are building more opportunities for us to coordinate care, build a more collaborative approach, and that embraces, again, the importance of recognizing substance use and mental health conditions as something that is more common than people would ever think, and it has to be something that is addressed. And at the primary care setting, physicians and other providers should be able to embrace that using their staff and their team and a coordinated approach around it. So we've seen that happening more and more. And my hope is that we will see those kind of changes. The complexity of reimbursement models, Medicare payer mixes, all those kind of things are commercial, et cetera. That's really difficult to just handle in one question, but certainly building collaborative care and a more coordinated approach at all levels is important.
Yeah, and I think that organizations have done a really good job of making the business case, especially to the medical and health system, that you can and you should be doing both. And that by investing in collaborative care and coordinating connections to services that go beyond the medicalized approach to mental health, that you'll see better outcomes and therefore have greater return on investment for the entity that we talk about. But I think that we still have a lot of progress, and philanthropy can help to seed that progress by supporting innovative solutions that are born out of community that really focus on that system of care. And I know that we are running out of time, and I want to go to our last question here around loneliness. And the topic of loneliness being really a really significant preventable risk factor for depression, addiction, and suicide. Yet there's a considerable amount of stigma that is still associated with loneliness, and prevents really intentional approaches to foster connection. So I'm curious, as you act as funders in your community and practitioners, how can we increase understanding among funders on the reality that addressing stigmatized risk factors like loneliness may be as important as providing those direct services that address direct need? I'll look to you, Vicky, to start, and then Kathy or Jackie, if you want to jump in with some final words.
I think we have to start by recognizing that communities that have been historically excluded in getting the resources and supports needed, that loneliness is a topic that's not uncommon. And we operate in community. I mean, it's important for us we're relational, and it's important for us to have interactions with one another. So I think the way to address that is, again, to call it what it is, loneliness. We don't have to label it, give it a medical clinical name, but to address it as it is. It's loneliness, and it's can cause other things, and it impacts our mental and emotional wellness. But again, being mindful of the terms and the words that we use in community, so that we use words that draw people towards getting the help that they need, rather than alienates them even more because of the stigma or even the lack of access to the resources and supports that could actually be helpful and beneficial.
Thanks, Vicky.
And I would add that, loneliness is a Western concept. We think about, well-being as it relates to, ethnic communities across the world. It's relationship, it's being in a relationship, mental health for young Black men of color is sitting on the stoop having conversations. It's about being in a relationship. For indigenous populations, it's about being together. For Latinx populations, it's about being in a relationship and together. And I think, for me, wellness has to be a two-way street. Philanthropy is Western, at its core too as well. And I think the question for us who would want to leave here with is whether philanthropy has perpetuated this notion of loneliness by creating programs that operate in silos, by being exclusive rather than inclusive, whether you have perpetuated this notion of loneliness in communities, and also to do some self-examining too as well, right? Historically, what it's been sort of an extension of wealthy white people. And I often say, this is the thing with, sort of like marginalized superiority or racism. It benefits anyone willing to participate in it, but it also harms them too as well. And wealthy white people often find themselves being some of the loneliest people on the face of the earth. So in this relationship that we engage in, it has to be a two-way street. The healing, so we can't only see, marginalized communities as being, the ones in need of healing. There's healing and wellness that needs to happen for philanthropy and wealthy people too as well. And we want to be an authentic, transparent relationship whereby we're all healing, as part of this process. Because otherwise, what we'll be doing is we'll be imposing some of these Western illnesses on communities that haven't experienced.
Great. Thank you so much, Jackie. And I know that we are at time, but Kathy, any closing words before we wrap up?
I know the question was around how can we promote more understanding amongst funders in particular. I think all of us on this panel are already converted and understand the importance of connection and all the other preventative measures. So connect them to us, like connect them to funders who already get it, is I think can be really powerful.
Thank you so much, Kathy, and thank all of you for joining us and really to shed light on the importance of supporting and lifting up culturally led programs. This is an important solution to improving mental health across communities, and we really appreciate everyone for joining us today. If you still haven't done so, we encourage you to download our full guidance on our website. The link is included in the emails that you receive after this webinar, and please look out for some emails in the next day to complete a survey, as well as when you close out this webinar screen today. Thank you so much for joining us, and we hope that as you walk away today that you'll consider opportunities for your organization to provide greater support for those organizations and those programs that are driven for and by the community to support mental health and well-being and community connection. Thank you. Take care.